And good evening, ladies and gentlemen. Welcome to the Facebook Live Your Health is Important broadcast. I am Dr. M.J. Collier, your host, producer, and on-air personality, and we are live in the studios here to answer your healthcare questions. We missed a week last week because I was out on vacation and I was playing in a tennis tournament, which I'm going to tell you all about just now. So thank you once again for joining, because we know you have choices and options, and we hope to have a special guest just for you this evening. So tune in and live. You know how we do it. We're going to start off with a quick monologue, and I'm going to tell you about a couple of things. One, I was on vacation last week, but I went on vacation to play in a tennis tournament in Mexico. And I actually was privileged enough to actually come in first place in that tournament, which was amazing. But one of the things, the last time I played in the tournament, I came in second place. And I came in second place because I was what I called missing a step. Or I felt like I had lost a step in my game. After having lost the 30 pounds, actually 33 pounds up to that point, much light on my feet, much faster, and much able to get, yet didn't lose a lot of strength as far as my striking abilities was concerned. My serve was good, etc. So I came back and arrived back into Atlanta on Sunday. And of course, weighed myself, and I saw that I had gained 3 pounds. Now, sometimes that can happen when you go on a long flight. You just retaining fluids. Could have been that I ate, because I did eat more than I traditionally have eaten over the last few months. And also I had caloric consumption from alcohol. Now, went back on the process, taking the Lipodrops and the Keto Max, back down those 3 pounds and then some. So today I'm happy to report that I'm back at the 33-pound weight loss. Remember, my original objective was 25 pounds, and then I decided to go to 30. So I'd have a little range that I could go back and forth and a cushion. And then I dropped down to 33 pounds. So, okay, I said, this is now, I want to go into the maintenance phase. I don't want to lose any more weight. I want to stay right where I am. So the maintenance phase would include, instead of taking the Lipodrops 3 times per day, which is what I was doing before each meal, I decreased it to 1 time per day. So for maintenance purposes, just using the Lipodrops 1 time per day before a meal, and taking the Keto Max with once or twice a day before my meals, breakfast and dinner, or breakfast and lunch, depending upon what I was going on. So join me on this weight loss journey. Go to the website right now, lipodrops.com. You too can drop that weight. Again, you have an opportunity to lose weight before your holiday functions, particularly your Christmas parties and your New Year's Eve function. You can be down a couple of dress sizes, ladies, before that event. Men, you can lose a lot of that belly fat, lose the muffin top with the Lipodrops. You can be the best you that you can be. For people that don't need to lose a lot of weight, you don't want to gain weight over the holidays, because people will traditionally put on 10 or 15 pounds over the holiday season, because you're gathering and you're eating large quantities of food that you traditionally would not eat. And you're also doing a lot of drinking. A lot of your calories are in the liquid form, beer, wine, and cocktails. So if you don't want to put on excess weight, you can also go on the Lipodrops weight loss plan. So go to the website, lipodrops.com, and you too can join me on this weight loss journey. I'm happy to say, again, 30 pounds down is how I'm telling you. 30 pounds down, tight chin. That 10 used to wobble a little bit, now it's loose. My shirts are loose. I took the plunge again this week and bought another size smaller wardrobe. I bought 5 outfits. Again, another size down. And again, I'm hoping this is where I'm going to stay, so I don't want to lose any more. But I want to stay at this weight with a tighter abdomen. My waist size down 3 inches, and really, really feeling tight. Body fat down, muscle mass up, and just feeling better than I have for the last decade. So thank you for listening. Thank you for being here for me. And we're going to talk about, we're going to bring up all about, we want to know who you are and where you're tuning in from. So, Javi, let's go down the list. Let's do our roll call. Okay, from Baton Rouge, CL Turner. Thank you, CL, for joining us. You are a regular. We appreciate you. Sean, Big Time Green, my man. Good evening, Sean. Thank you so much for joining once again. All right. There we go. We got Sean Big Time again. Joyce Bethel. Hi from Maryland. Hi, Joyce. Thank you so much. You sound good. Hey, Doc from Chicago. Sharon Gober. Thank you, Sharon. Sharon. Michelle James. Hello. Dr. Collier. Thank you, Michelle, for joining us this evening. Let us know where you're joining us from. Miss Makiba Boland, right here in the Atlanta area. Good evening, everyone. Kathy London from Queens, New York is in the house. So Queen from Queens. Sabrina Washington from St. Louis, Missouri. Had a lot of people from St. Louis at the tennis tournament this weekend. Had 8 participants from St. Louis alone. That was very good. Essie Weekly from Pflugerville, Texas. I hope I'm saying that right, unless the P is silent. Paula Hawthorne Bond from South Kakalaki, South Carolina in the house. Darlene Rogers Heath. Greetings from Orlando, Miss Rogers Heath, my good friend now and patient extraordinaire. Sherry Gamble, good evening from Dallas, Texas. Hello, Sherry. How are you? Val, hey, Val, how you doing from the Atlanta area? So glad that you joined us this evening as well. Essie Weekly, congratulations. Thank you so much for your congratulations, Miss Weekly. I appreciate that. Kathy London, also congratulations, Kathy London. I appreciate your support. And let me tell you, it was hard, but we got it done. Meredith Hicks, Little Rock, Arkansas. Angel Hatchett from Denham Springs, Louisiana. Brenda Smith from Kansas City, Missouri. All right. Only Kansas City, Kansas, and Kansas City, Missouri. Adrian Sewell joining from Raleigh. Okay, Natasha Glassman from Coconut Creek, Florida. Okay, Natasha, thank you so much for joining in. Okay. C.L. Lamont from North Carolina. Okay, Chris Goodjoin from Greenville, South Carolina. Okay, Stephanie Tanner from Palm Bay, Florida. I hope you didn't get damaged by the storm recently. Okay, Shauna Cook from Clinton, Mississippi. Okay. Winnie King from Terrell, Texas. We got Texas now. Well, let's move out west. Who we got from California? From Richmond, Virginia. Lena Jenkins from Murfreesboro, Tennessee. Murfreesboro. I love Murfreesboro. Got some history there. Used to go there and give lectures all the time. Ivy Hazley from Phoenix, Arizona. There you go, Ivy. You are from the west. B. Dukes from Northern Virginia. Hey, Miss B, I appreciate you. Keep helping us. Keep serving your community in politics. Good evening from Palm Bay, Florida. Stephanie Tanner. Okay, Stephanie, we appreciate that. Okay, Howie, thank you so very much. Let's get to it. We're going to answer your healthcare questions. This is the People Show. Whatever topic you would like to talk about. Again, I just want to remind everybody, if you have not had your flu shot yet, get your flu shot as quickly as possible. Next time you go to the grocery store that has a pharmacy, next time you go to the pharmacy, just walk up. You can probably get it without an appointment now. 2 weeks from now, you're going to be glad that you did. If you haven't gotten it 2 weeks from now, they're going to be packed. It's going to require much more complicated. You're going to need appointments to go. It's going to be just difficult to do that. And believe me, the flu shot will not only protect you from the flu, but it will optimize the performance of your immune system, so it'll protect you from other infections as well. Remember, there is no vaccine for the respiratory syncytial virus, the RSV. A child 5 years old died in California yesterday from RSV. And this is traditionally a pediatric problem, usually young babies and children under 5 years old. But it's affecting adults now, particularly those 60 and older are getting respiratory syncytial virus, getting pneumonias, getting very sick. We don't have a documented death yet, but I think we probably have. But people just aren't calling it RSV. They're just calling it pneumonia or possibly even COVID. They could have a dual infection. But believe me, this RSV is a new animal now. It has metastasized or morphed into something that's now affecting older individuals versus it being a childhood disease. So get your flu shot now. If you have not gotten the new COVID bivalent booster, it is the only booster that is available now. So if you've had your first 2 doses of the Moderna or the Pfizer or the first 1 dose of the Johnson & Johnson, your next shot will be the new bivalent booster that protects you from the original coronavirus and the Omicron variant. Very effective in stopping you from getting really sick, very effective in preventing hospitalization and death. So there we go. Let's get your questions going. Okay, Winnie King states, if your blood pressure is holding the regular numbers like 120/60, 127/71 today, do you still have to take medication? Winnie, yes, that's probably why it's holding at those numbers. That is absolutely excellent control. Most people that take their medications find that they do remain controlled, and it's much easier to get and stay controlled than it is to regain control if you stop taking the medication and your numbers get out of whack again. So if those numbers are based on you taking the medication is working for you wonderfully. Blood pressure is not something that you graduate from. You don't treat it and then it gets better and then you stop taking the medication. Embrace the fact that you have to stay on the medication, but also appreciate the fact that your blood pressure is well controlled and that you're doing great. So we appreciate that, and we are so glad that you are taking your blood pressure medicine. Keep doing what you're doing, Wendy. Those are great numbers. You just added 10 years to your life. Okay, next question. Okay, I think we're waiting. Joyce Bethel says, do I need to get a humidifier? I have dryness in my nostrils, especially at night. Yes, a humidifier, and get one with a rheostat on it. One, do not put tap water in your humidifier because there are chemicals that have been added to tap water, like fluoride, to help give you strong teeth. We're not drinking tap water. Everybody's now too bougie for that. They only want bottled water. But because of that, we're having dental disease and dental decay and teeth fractures and loss of teeth because people teeth are losing their strength because they don't have fluoride that they normally would get in drinking water. But you put distilled water or some bottled water in your humidifier, take the rheostat and turn it to the point that you're just getting a little smoke. And then when that happens, you'll see that you're going to, that way it's not going to cause too much moisture to get in your carpet and your drapes in your bedroom. So the other thing is to use a saline nasal wash to control your nasal passages. It moisturizes. One, it's very inexpensive. You can get a large bottle for $1. And you rinse out your sinuses before you go to bed. You can even put, there are some saline gels that you can put on the entrance of your nose, and that will help keep it from getting too dry as well. But a humidifier is great. The dry heat that comes out of the heaters in our home is very bad for the sinuses, and it can dry them out and give you everything from just a sinus infection to nosebleeds. So very important that you try to keep that lining of the sinuses moisturized. It's a very thin coating. It's the only place in your body that you have very superficial blood vessels. That is why if you blow your nose too aggressively, you can make your nose bleed because there are arteries and veins just literally lying under this covering that's kind of like saran wrap. But if it dries out and cracks, it opens up and then those blood vessels can just ooze blood. So that's what can happen. So great question, Joyce, and so timely as well. Okay, Arnita Norris Grice from Mississippi. I'm 55, and what can I take to boost my metabolism? Phenamine good for losing weight. Phenamine is excellent for losing weight. I do utilize it in my suburban weight loss facilities when indicated. It's a good option because it does two things. It stimulates your metabolism and it decreases your appetite. So it makes you burn more fat and allows you to eat less without feeling hungry. So there are only a few contraindications to phentermine. That is a history of a previous heart attack or stroke. If you've had that, you don't need to take phentermine. If you have uncontrolled high blood pressure, you can have high blood pressure. As long as you're taking your blood pressure medication, your blood pressure is controlled. The phentermine should not make your blood pressure increase. It should stay controlled, but it will still give you the benefit. If you have thyroid disease and you're taking thyroid replacement, you cannot take the phentermine. And if you have a history of seizures, you cannot take the phentermine. And then so most people have none of those things. So for regular people that have no substantial health issues, maybe a little high blood pressure, as long as you're taking your blood pressure medication and it is controlling you, the phentermine is safe to take, and it is very, very effective. And one of the medications that I utilize in addition to the lipo product line. Now, the lipo product line, which you can see at lipodrops.com, has no stimulants in it, will not affect your blood pressure. Also very good at increasing your metabolism. That is what the Lipodrops does, and decreases your appetite as well. Perfectly compatible with any disease state and any prescription medication that you could take. One dropper full under your tongue just before you eat. Hold it under your tongue for 2 minutes, then swallow, and you will lose the weight. Okay, great question, Arnita. Janae Allen. Hey, Janae, how you doing? About eating more vegetables and fruits, does that keep my blood sugars, cholesterol levels normal? Vegetables, yes. Sometimes various fruits can increase your sugar because they can have fructose corn syrup in them. So you have to be very careful about fruit juices, particularly things like orange juice, even cranberry juice, which a lot of people would drink to help with their urinary tract symptoms, can increase your blood sugar. So it would be good to see how they affect you. Most vegetables won't do that. So if it's crunchy, if it's green, yellow, those are good things to eat and probably won't cause your blood sugar to go up. But things that are red, pink, fruits that I recommend that probably will minimize your blood sugar would be things like bananas and grapes. But things that could shoot it up would be oranges, and juices can do that. So I would just Google fruit sugar content of various fruits and vegetables and pick out which ones you like. Today, you don't look like you have a weight problem, so that will keep your blood sugar and cholesterol levels normal. So you might not have to consider much of any of that. because, as long as you're eating what you're eating, you're staying healthy, you probably will be okay. You cannot go wrong with fruits and vegetables as a major part of your diet. Those should take up 2/3 of your plate, and then a protein source such as fish, chicken, or meat, beef, or pork, even as an option, 1/3 of the plate, and that's a healthy meal. That is a healthy meal that should allow you to maintain normal blood sugars and cholesterol levels. If you have a problem with diabetes, then that's a different conversation. If you have a problem with high cholesterol already, that's a different conversation. But when people ask me, what can I eat, Dr. Collier? I have one mantra, and you can say this, and please share it with everyone that's watching this Facebook Live tonight. If it swims, you can eat it. That means basically anything from the ocean. If it flies, you can eat it. That's any type of bird or fowl except duck. Duck is the highest fat food that exists. That's why ducks float on water, because their fat content is so high. They taste amazingly good and melt in your mouth, but that is why they're so high in fat. And if it walks on earth with cloven hooves, that's beef and pork, then you need to limit your consumption of that. Your preferred method of food preparation is baked or broiled, not fried. And those are the only guidelines you need. You don't have to read labels. You don't have to worry about more intimate nutritional information. That is a good basic guideline to decide basically everything that you eat is going to be healthy. Baked or broiled, not fried. Instead of getting the fried chicken from the fried chicken place, get the baked or the broiled chicken that's at the checkout counter at your local grocery store for $5 or $6 for an entire chicken that can feed your entire family. And they tasty. They're sitting there in those bags and they've been soaking in these juices all day, or not all day, but long enough. They're very tasty. So good options as far as your food is concerned. Great question, Janae. Okay. Sherry Portier, are there alternatives to hysterectomy? You might get the question of the day, Sherry. Yes, there are. There is uterine fibroid embolization, UFE. This is a phenomenal procedure. It is a surgical procedure, but it is minor surgery. You walk away from it. Now, the thing is, what they do, they insert some beads basically to block the artery that go to the uterus. And those arteries usually shrink fibroids that's supporting the blood supply and feeding fibroids. The fibroids no longer getting that blood supply, so they basically die and shrink and slough out. They liquefy. Your body passes them out. So no problem there. That is something that most people with fibroids can do. You can also treat it, depending upon what symptoms you're having, hormonal therapy. Sometimes birth control pills or other forms of hormone can control painful menstrual cramps and heavy menstrual flow, which is the main reasons that people get hysterectomies. But if you have fibroids, the uterine fibroid embolization is the procedure for you. Some fibroids cannot be treated that way, but the vast majority can be. The problem is that doctors that don't do that procedure are not going to discuss it or offer it as an alternative. So, and most OBGYNs, who are the doctors you would think would do this, don't do it. This is a procedure that is performed by radiologists. So radiologists do this procedure. And again, it's an outpatient surgical procedure and rarely requires hospitalization. You go in, takes a few hours, and it literally is life-changing. There's a doctor in Atlanta that started what's called the White Pants Initiative. His name is Dr. John Lipman, Lipman. Google him, Dr. John Lipman. And then when you call him, tell him that I referred you, and he can give you much more information about alternatives to hysterectomy. That is the question of the day, Sherry. Thank you so much. Adrian Seawall, my wife had total knee replacements just over a year ago. Her question is it normal to still have some swelling? Adrian, not normal, but a common problem with knee replacements. You would think that after a total knee replacement, there are no nerves there and it shouldn't hurt. Yet some people, I have a patient right now in our practice. She's had one knee done and she's got pain in both knees. And the one that's hurting her the most is the one she's already had surgery on. So that makes no sense clinically, but obviously it can't happen because it's happened to her. And I tell people, if something happens 1 out of 1,000,000 times, and people say, oh, that's so rare, it happens 1 out of 1,000,000 times. Well, if it happens to you, it's 100%. So, I never say never. And when a person tells me that they're having an issue, I accept that as a disease state and problem that they're having. So the swelling is not normal. One, we need to be conscientious and careful about weight. In particular, when you have knee issues, degenerative joint disease, usually osteoarthritis of the knees is the reason that you get knee replacements. Weight loss always helps with that, dramatically so. A loss of just 10 pounds can make a major difference in how those knees are feeling. She may still need to take an anti-inflammatory, such as ibuprofen, Celebrex or Mobic, Advil, Aleve, Naproxen, prescription strength could do it. And if she's taking long-term anti-inflammatories, something to protect her stomach, such as Pepcid, famotidine, or omeprazole, so that you don't get gastritis or even an ulcer from taking long-term anti-inflammatory therapy. So this is going to require a partnership between her and her provider. The doctor that operated on her, she may need additional physical therapy, something to help with that, because once you start to get these types of problems and complications, you may ultimately end up getting a repeat of the knee replacement, and you don't want to have to go through that if you can help it to fix the problem. You always have to be concerned about infection in an artificial joint. Of course, that needs to be evaluated as well. So have her follow up with the doctor that operated on her, or get a second opinion from somebody that's totally out of the loop, and see if you can get a different answer or option for that. She can start off even with a primary care doctor to start some of the treatments that I just discussed. And then if not, follow up with the orthopedist that did that surgery, or get a second orthopedic opinion. Great question, Adrian. Tam, Scorpio's finest, West. Boy, I love that. What's good to clear your sinuses for congestion quickly? The saline nasal spray will do it instantly. You can get a saline nasal wash, a bottle of saline solution that doesn't sting, hurt, or burn. It's very inexpensive. For $1 or $2. You can get it from the store where everything used to be $1. Now it's $1.25. You can buy it anywhere, but from those stores, it's very inexpensive. Then once doing that, to prevent the congestion from coming back, a nasal spray such as Flonase or Nasal Cord, which are now over the counter as well. So you rinse out your sinuses with the saline spray to clear the congestion. Then you use the steroid spray to prevent the congestion from recurring. So for maintenance purposes, if you have an allergy issue, then a non-sedating antihistamine such as Allegra, Xyzal, Claritin, or Zyrtec, all would also be good. Don't use the nasal sprays that have the decongestants in them, because you will become quickly, the term is addiction, but you're not hooked on it like you would be another drug. The problem is that your body needs it then to stay clear. And if you stop using it, you'll have rebound effect and be very, very congested for an extended period of time, and become dependent on that medication to keep your sinuses clear. So you don't want to use a nasal spray with a decongestant in it, like an Afrin, for any extended period of time. But temporarily, it can give you, immediate relief, because that's what it does. Okay, great question, Tam. We appreciate you. Big Daddy still rocks 29. I hope 29 is your age and you should still be rocking. Hey, Doc, what about testicular pain after ejaculation? Not every time, but it happens frequently enough for me to notice. Let me tell you something. This is a complaint that I'm hearing more and more. Again, I would highly recommend that you want to get tested to make sure you don't have any infection in your urinary tract. It doesn't have to be an STD, although STDs have to be taken into consideration. But when you get pain deep down in the testicles, that is not normal. It could be overuse, which, there's no problem with that. Frequent ejaculation usually clears them out. It could be underuse, which means you're backing up, so to speak, and that you need to keep and decompress those testicles. So there's a variety of things that need to be evaluated. Basic urinalysis will say if you have a urinary tract, then STD testing can tell. There's now a genetic urine test. I call it genetic urine pathogen testing, that can test you for 50 different things, including all STDs, syphilis, gonorrhea, chlamydia, herpes, trichomonas, which traditionally has been no test for men, only anecdotal. Your partner gets it, so you get treated for it, but there was no test for trichomonas in men. This urine genetic pathogen testing is available in most doctors' offices. They send it out to most labs, can now do this technology. Your insurance will cover it. And oftentimes I will be surprised at the types of pathogens that will grow, like Klebsiella or E. coli. These are not sexually transmitted diseases, but they are things that shouldn't be in that area. And so it also will test it against various antibiotics to see what antibiotic that you need, and will give you great benefit from it. So this is something you don't want to live with, with testicular pain. That's your body telling you something is not right. So get it checked out, Big Daddy. We want you to still be rocking years from now and saying, boy, I'm so glad Dr. Collier sent me to the doctor to get this tested and treated. Because if it backs up into your prostate, prostatitis or infection of the prostate is a curse. Very difficult to eliminate. Oftentimes it just becomes a chronic infection where you have chronic awareness of yourself down there, discomfort, pain, sometimes when urinating, oftentimes more likely when you ejaculate, and nobody wants to have pain or discomfort when they ejaculate. That is the big prize. That is the big price. When you're doing that, you want to be able to enjoy your sexual activities. That is, just what life is about. You want to be able to enjoy it, and it should not be painful. Great question, Big Daddy. Pamela Burley. Pamela, thank you so much. What is my recommendation to cure long-term cough? I was exposed to a grandson who had RSV and the other earlier some who had COVID. Now I can't get rid of cough after 2 months. I've taken Z-Pack, steroids, long tests, and even went to the ENT for a scope. The problem with long COVID is inflammation. To treat inflammation, you need anti-inflammatories. That can be a steroid, which you've used. It just may need to be on it longer. That could be antibiotic. The Z-Pack is an antibiotic that has a natural anti-inflammatory response, particularly for the lung tissues and your bronchial tubes. So you've been treated appropriately, you just may not have been treated adequately or for a long enough period of time. When I tell my patients for long COVID, after you've completed a course of antibiotics and possibly steroids as well, you need natural anti-inflammatories. The 2 most common I recommend, omega-3 fish oil. You can go to our lipodrops.com site and get the Lipo Omega 1 or 2 capsules. You may need 2 capsules twice a day to give you optimal benefit and anti-inflammatory perspective and in cardiovascular health as well. And then the vitamin D. People take vitamin D, but they're not taking it at a therapeutic dose. Our Doctor's D, vitamin D3 product, on the lipodrops.com site is 5,000 international units per day. You get 5,000 international units per day. You just take it. It's not going to be an overnight benefit, but it will give you great benefit and make sure you're not coughing 6 months to a year from now or even permanently. I have patients now that had COVID a year ago and they're still having symptoms. We treat them with the long-term anti-inflammatory, symptoms improve or resolve. Again, sometimes it may require another course of antibiotics, another course of steroids, whatever it takes. But the point being, get treated and you've been to an ENT, you've been doing all the right things, but you just may need more astute follow-up. In other words, I would go get checked 2 weeks later, get checked again if I'm still having symptoms. But if you start the natural anti-inflammatories, and you can do that along with any of the other things that you were doing, the steroid packs, the zithromycin 8 Z-Pack, any of that stuff is still compatible with the vitamin D and omega-3 fish oil. Other natural anti-inflammatories include turmeric, curcumin. They have capsules, they have powders, they have teas, they have various preparations of those natural anti-inflammatories that should become now a regular part of your life, because your lung tissues have been sensitized, they have been inflamed, and you don't want to be pulmonary cripple, basically, because you're coughing all the time and you can't carry on conversations without coughing. You can't be in social environments. People going to start giving you the funny look if you're coughing all the time, because they are concerned that you're passing along that good news and possibly infecting them with RSV or COVID. So we want to make sure that you're the best you that you can be. Take care of yourself. Okay, next question. Meredith Hicks. About 15 years ago, I had a cyst removed from my right breast. In my regular checkup and doing my annual mammogram, I noticed a small lump near my armpit. I've been told I have dense tissue. How do I make sure that's all it is? Concerned because I have a family history of breast cancer. Meredith, the only way to determine that is to get a piece of the tissue, and that would be biopsy. That is the only way to make a diagnosis of cancer. Anything else is, I think it looks like, it could be, or it might be, or my best guess is. That is what the doctors will tell you. The radiology reports from mammograms, MRI of the breast, x-ray, they will all give you nebulous answers, but won't give you the answer. The only way to get the answer is to biopsy that tissue. And with your family history of breast cancer, and with the fact that you are concerned about it, that little voice sometimes talks to us and say, we need to do something about this. Don't just ignore it. So I would get it checked out further. You may have to go to a breast specialist to do that. Just Google breast specialist in my area. Doctors that could do it would be general surgeons that specialize in breast, but there are a subspecialty of breast doctors that can do it. Most of them could probably do a biopsy in the luxury of their offices, so hospital is not an issue, and so you don't have to worry about that. But because you asked the question, the only way to answer it is to get a biopsy of that tissue. Anything else is just a medical opinion that could be right, usually is, but sometimes can be wrong. And you don't want to be that person who say, I thought it was, but I was wrong. Okay, great question. Renor Woods, how much is too much B12? Well, B12 is, the injections that I give in my office are 1,000 micrograms per milliliter of B12. You can get oral B12 drops that you take under your tongue. Any other preparation for B12, a B12 tablet, is not absorbed consistently and appropriately from your GI tract. So B12 tablets are not a good way to get B12. B12 liquid that goes under your tongue. There are dissolvable tablets that will melt under your tongue. And those, depending upon how many milligrams are in the preparation, then you need to see which dose to take. So I would say go to a place like GNC or the Vitamin Shop or your local naturopath physician and get some information about which products are available, which ones to take. But again, they're available in most drugstores now. They used to be difficult to find, but I know that you can get them at a GNC or a Vitamin Shop or someplace like that. But I always tell my patients to get the drops or the dissolvable tablets. When they come in with a bottle that they swallow, it's a total waste of time because you will never get therapeutic B12 levels. The only other option is to get B12 injections. I do them at my office. Most doctors will do them at their office. They have it available. The vast majority of the time, insurance will not cover them. They're not expensive, but they are necessarily not covered by insurance. You can prevent your insurance and call them and ask them, will you cover a B12 shot? And they may say only if you have a diagnosis of B12 deficiency, which a B12 deficiency is not necessarily, doesn't mean that you need B12. You may just want it for energy. You may want it to be the best you that you can be. You may have a range of normal for B12 and you're on the low side of normal and you want to be in the middle on the high side of normal. So, if the insurance company says we're not going to cover it, and they usually don't. So don't be surprised at that. Just ask your doctor for, can you get a B12 when you're at their office, and they will be happy to accommodate you. I promise. Okay, next question. Okay. Chris Goodjohn, do I recommend taking CoQ10 on a daily basis? If so, what milligram amount? Chris, it depends on the CoQ10 preparation, and CoQ10 is a great supplement to take, particularly if you're also taking cholesterol lowering medications in the class of statins. If you're taking a statin, you're going to need that. If you don't, then the CoQ10 just as a daily supplement into itself, you can probably take a lower dose. So it depends on the preparation. Each bottle recommend and say take this, take one tablet, take two tablets. It just depends. So I don't want to give you a specific number because it may vary depending upon the type of preparation that you have. It comes in tablets, it comes in capsules, it comes in liquid caps, it comes in gummies. So there are various types of preparations to take, and the recommended dose would vary depending upon the type of preparation that you have. So not difficult. Anybody that has it as a supplement that's providing it to you ought to be able to tell you what's the recommended dose for that particular brand or type is. Okay, great question. Vanessa Bennett, hi Vanessa, how are you? Are there any natural remedies against onset sciatica? Yes. Anti-inflammatories, one, because sciatica is inflammation of the lower back that travels down the sciatic nerve. It can go down the posterior or lateral leg, the outside of the leg or the back of the leg. It can go to the mid thigh, to the knee. It can go below the knee. It can go all the way down to your feet and toes. One thing about it, the main thing about it, one, anti-inflammatories treat the inflammation. The problem is to relieve the problem that's causing you to have sciatica. It could be postural. It could be a chair that you're sitting in. For a lot of men, is putting a wallet in their back pocket. If you got a fat wallet like this one is fat, doesn't have anything in it but multiple cards, but a fat wallet like this in your back pocket presses directly on the sciatic nerve. And so women don't have that problem because you put your things in purses. But the things you can sit on, the type of chair and surface that you're sitting on, the chair should be cushioned enough and ergonomically correct so it is not putting pressure on your sciatic nerve. Do not slide your buttock up and have the bottom of the chair cutting across the posterior thigh, in the middle of the thigh. A lot of people sit on the edge of their chairs, and that can cause sciatica. Sitting straight up and relaxing the back. Sleep posture can aggravate it. Of course, heavy lifting, bulging disc that presses the nerves that comprise the sciatic nerve, a bulging or ruptured disc in your lower back, usually the L5, S1 level or L4, L5. That's the primary regions that will be affected and cause sciatica. Then you can do that. Get to know your friendly neighborhood chiropractor. That is one of the best things you can do. They can give you some stretching exercises to help minimize the discomfort from sciatica. So this is a curse. This is why chiropractors are in business, because of low back pain, sciatica is not all car accidents. Back pain, number one complaint at the primary care doctor's office, besides blood pressure, diabetes, and high cholesterol. Number one complaint, back pain. After that, headaches. So getting to know your friendly neighborhood chiropractor may give you great relief. They can also, like I said, you go 2 to 3 times per week to get control. And then once you control, you might want to have a maintenance program where you go get adjusted once a month or something like that. But whatever they teach you as far as how to stretch your back out, you do those exercises on a regular basis, because people with sciatica, only get progressively worse over time. And the earlier you intervene, the longer period of time you're going to go pain-free, because the sciatica can be a problem, and ultimately people even get surgery seeking relief. It rarely gets relief from surgery. Sometimes it does, but sometimes the person does well immediately post-op, but then a year later they're back to square one. So the objective is to treat this naturally, so to speak, conservatively. That's anti-inflammatories, muscle relaxants, muscle stretching exercises, yoga, tai chi, chiropractic adjustments, all of those things. That's what I recommend, Vanessa. Thank you. Great question. Ron Woods. Ron, I appreciate you checking in with me, man. I have chronic migraine headaches and seizures. I can take migraine headaches, but treated before the headache actually gets extremely bad. Can you speak on seizures, please? Thank you very much. Ron, one good thing, one of the primary medications for seizures helps tremendously with headaches. So this is a combination thing that needs to be, you and your neurologist need to be good friends to seek, 1, medication that controls your seizures, 2, medication that gives you headache relief. Migraine headaches are a curse. They are literally, nobody knows why people have them. There are thousands of theories, but there's no one, this is why you have migraines. No test that you can get that determines the reason that you have migraine headaches. There is tension, sleep deprivation, stress, anxiety. When you get to stress and anxiety, we don't have a real reason, because stress and anxiety causes everything. But it's not necessarily a diagnostic direct causation. You have this, so you have that. And so there's no migraine test. When you get evaluated for migraines, you get CT scans of your head and MRIs of your head, and sometimes even vascular studies where they inject dye into your head to look at the vasculature and the blood flow. All of those things are looking for things like brain tumors or change in the flow of your cerebral spinal fluid and things like that. And most people have none of that. They just have migraine headaches. Thank goodness. You find out you don't have a brain tumor. You're happy about that, but you're still suffering. There are great migraine relief medications now that are available. You've seen some of them advertised by celebrities. I know that one of the Kardashian sisters advertises one. So Serena Williams advertises one. They are all new technology as far as the treatment of migraines is concerned. But there's also, again, combination medication that works great for seizures and migraines. And so you work with your neurologist, sometimes your primary care provider as well, to find the medication that works for you. Everybody has one that works for them optimally. Everybody says, oh, I take this and it gives me almost immediate relief. There are nasal sprays that contain triptans. That was a major breakthrough in the treatment of migraines. So they have tablets that melt under your tongue, because sometimes the nausea is so bad you can't swallow a pill and keep it down. If you drink enough water to dissolve the pill, it makes you vomit, so you throw it back up. But these dissolvable tablets and nasal sprays give you the same benefit without you having to worry about the nausea. So one of the key diagnostic traits of a migraine headache is nausea and vomiting. So you have photophobia, changes in your visual acuity or sensitivity to light. That's why people want to be in dark rooms, and nausea with vomiting. That's the diagnosis of migraines. If you don't have those symptoms as well, you don't have migraines. People use that term sometimes when they really just mean I have a bad headache. But the diagnosis of migraines, requires those comorbid conditions as well. Okay, great question. Next question. Olivia Moody, good evening, sir. Would you suggest using the increase stomach acid? I'm dealing with acid reflux also. Well, if you have acid reflux, you don't want to increase stomach acid. I cannot think of a single time or reason that you would want to increase stomach acid. Your stomach usually creates adequate acid to digest your food. The problem is oversecretion. If you are not eating on a schedule that keeps something in your stomach and your stomach doesn't have anything to digest, guess what? It starts digesting itself. That's when you get gastritis or inflammation of the lining of the stomach, or even a gastric ulcer, where it is the acid is eating through the lining, is now eating the actual stomach itself, digesting your stomach just as it would a steak or any food that you have eaten. So that's why going extended periods of time with an empty stomach is not good, particularly if you have a stressful lifestyle, and everybody does. If you're Black in America, you have a stressful lifestyle, so you need to coat your stomach. I like to recommend yogurt, particularly Greek style, because of the benefits of probiotics, and I do recommend probiotics to help with your condition, not necessarily with the acid reflux, but it changes the pH balance in your stomach and gives you great relief from those symptomatologies, and allows the good bacteria to live in your stomach and your intestines. So go to the website, lipodrops.com, look for the lipobiotic product, take that daily, and you will get great benefit. Other issues with acid, now all over-the-counter medications, those over-the-counter doses are 1/2 the prescription dose. So you may want to try Nexium, Prilosec, omeprazole. All of these are now over-the-counter. Take twice the recommended dose if you need it. You can take the recommended dose for the over-the-counter, which is usually 20 milligrams. See if you get relief from that. If not, take 40. That tells you whether the prescription strength will do good for you. And then if it's working for you, and it usually works for most people, then you can go to the doctor and say, look, I need this medication at prescription strength. And most insurance companies will cover one variation or the other of them. There are 4 or 5 on the market. They're all good. Everybody has their favorite. So decide which one, but don't let this become more of a problem than it already is. Simple things you can do: don't eat within 3 hours of lying down to go to sleep, because you'll get reflux. If you have an adjustable bed frame, if you don't get an adjustable bed frame, or sleep on no less than 3 pillows. That's 2 pillows for your head, 1 pillow behind your neck and shoulders, so that your body is elevated about 15 degrees up to 30 degrees. That's a decent sleep posture. You can sleep at that angle, and you will find that without the reflux, you'll sleep much better. Sometimes reflux is so bad you feel like you're vomiting, in which you really are. The acid comes up and gets in the back of your throat. It can also do major damage to your teeth, cause your teeth to crack, breaks down the enamel, causes dental and gum disease, foul breath, all kind of bad things. If that acid gets that far up into your mouth and teeth, it can affect them negatively. Great question, Olivia. We appreciate that. Valerie Patterson of Illyria Patterson from Tennessee. What bottled water do I recommend? What type of health issues can occur from drinking unclean bottled water for a long period of time? Thank you. Well, I would think most manufacturers give you a decent product. The problem is what's in the bottled water. Is it truly coming from the springs of Europe, or is it coming out of the tap behind the building? They just put it in a bottle and give it an elaborate name that makes you want to buy it. I think that in most major cities, the tap water is perfectly good, and it's an elegant solution. It doesn't cost you any more versus buying bottled water. But other than that, I don't think there's one bottled water that is above and beyond any other product that's like the greatest bottled water of all time versus the least. Water is water. As long as it's clean and not contaminated, then it will probably be good. Drinking dirty bottled water of any type, or dirty water period, for any period of time, can cause a lot of GI problems, nausea, vomiting, diarrhea, thing, you will know if that water is bad. And if chances are you would not be able to drink it for an extended period of time because it will cause you to have some GI issues. Bad bacteria can grow in water that's been sitting around for an extended period of time. So you want to make sure that it's relatively fresh when you get it. But if you open a bottle of water and it doesn't smell right, doesn't taste right, the first sip, don't keep drinking it thinking it's going to get better as you get toward the bottom of the bottle. Anything can happen in the manufacturing process. So it should have minimum taste. The water usually has no substantive taste to it. That's why we drink it. But there are places that do. I know that I went north once to Cincinnati, and I thought the water was amazingly different, to say the least, from Atlanta. It had more of a sulfur taste, and that's because what they used in it in their water purification process. So it was different from what we use here in Atlanta. And so I think here in Atlanta we have some very good tasting water, but most large cities in this day and age have water that you grew up on drinking, used to drink it out of the water hose that's been sitting in the sun all day. So chances are that it's not going to be a problem for you. Okay, next question. Can I recommend an over-the-counter product or herbal supplement that will suppress your appetite? Yes, the Lipodrops Maximum Strength will suppress your appetite very well. You can get it at our website, lipodrops.com. There are other herbal products that are supposedly naturally supplement green coffee bean extract. Is very good for that. It is available in a variety of different forms. We used to have it on our website. We may still have it on the Lipodrops website. A green coffee bean extract is a great appetite suppressant and helps increase your metabolism as well. But again, between our Keto Max, our probiotics, and our Lipodrops Maximum Strength formulation, that will give you optimal weight loss and appetite suppression and allow you to accomplish your objective, which is to lose weight. And it's not just appetite suppression, because you can eat around appetite suppression. You smell something that smells good, or it's just time to eat. Even if you're not really hungry, you can eat, and you can overeat. The problem is our sensation of satiety, ergo feeling full, lags behind us actually being full. So you will eat and you won't feel full, but you are full, and you keep eating, and then you get overstuffed and overfull, particularly around the holiday period. And oh, I can't believe I ate the whole thing. I need to go take a walk, which is a great idea, particularly after Thanksgiving dinner. Don't just lay down on that food watching football. Get up and move, take a walk around the block, go take the dog for a walk, whatever you need to do to help get that food down, and so that you're not having problems with indigestion later that evening. Okay, Tony, great question. Renee, Miss Fab Stephanie. All right. I love that. From St. Louis. I've been taking probiotics for about 5 weeks and vitamin D 50,000 units a week. I was vaccinated and had 1 booster. I have type 2 diabetes and diagnosed with COVID for the 2nd time. The cold-like symptoms are lingering: cough, congestion, and runny nose. Any suggestion on what to take to get rid of those symptoms? Yes. People get COVID and they're just going through it and not really treating the symptoms. Treat the symptoms just as you would any other cough, cold. People will take Theraflu at the first sign of a respiratory tract infection, but they won't take it when they've been diagnosed with COVID. So most of the things I'm going to suggest are available over the counter. A non-sedating antihistamine. My 2 favorites I recommend are Allegra 180 milligrams or Zysol 5 milligrams. The other 2, Zyrtec 10 milligram tablets and Claritin 10 milligram tablets. That is my pecking order of preference, but they are all good, and everybody has one that they like. They're all available over the counter. So non-sedating antihistamine, that helps with the cold and allergy type symptoms. Then a decongestant mucolytic to help clear your chest and your sinuses. Maximum Strength Mucinex DM. DM, not D. D has a decongestant in it. It's behind the counter. You got to pull your driver's license out to buy it for a variety of reasons. So get the DM, which won't affect your blood pressure, but will suppress your cough. What a mucolytic does, it makes thick mucus thin and watery. When it's thin and watery, your body can either reabsorb it, or you can cough it up, hack it up, get it out of your system, get it out of your sinuses, blow in your nose, get it out of your chest. You know how easy it is to get thin, watery mucus up than it is to get thick, chunky mucus out of your chest in particular. Or even if you blow your nose, if it's thin and watery, it comes out very easily. If it's thick, you never feel like you quite get it out. You still feeling congested even after blowing your nose. So a mucolytic, that is what Mucinex is. Same Guaifenesin, the same thing that's in Robitussin. So you can get it in a liquid form if you like. But to get in liquid form, you have to take a lot of the liquid to get what you would get in a maximum strength Mucinex DM tablet. So that twice daily as well. I would also take, there's a cough syrup called Delsum that I like. It's over the counter. Robitussin is good. Delsum is better because it lasts 12 hours. That will help suppress your cough. And then natural anti-inflammatories. The problem with persistent symptoms with COVID is inflammation of the bronchial tubes, the lining of the lungs, and the bronchioli. So you have to calm that inflammation down. How do you calm that inflammation down? You're already taking the vitamin D. That is excellent. Then omega-3 fish oil is a good natural anti-inflammatory as well. And then things that I talked about, curcumin, turmeric. All are good. All will help. And all are going to take time to relieve those symptoms. Start taking them now. Within 2 weeks, you'll feel much better, if not totally be relieved. Within 4 weeks, it may take that long. It may take 4 months. But the point is, you will get benefit from taking it by keeping that inflammation down. And if you don't do it, the inflammation will only get worse, and you end up feeling like you're getting it again. Retesting positive for COVID is sometimes not a real positive test. The thing is, what they're testing for, the antigen testing, will detect dead viral particles as well. In regular people, that COVID virus runs its life cycle in 10 to 14 days. So even if you're still testing positive for weeks after that, and you can, that doesn't mean you have an active infection or a reinfection. One of the best things you can do, again, make sure you've been boosted and vaccinated. Too, and if you had a positive test, I just wouldn't keep retesting, because you'll get false positives unless you're like 3 months out. And then 3 months out, that's different. 6 months out, definitely. But if you're just a few weeks out or less than 3 months, then I think that oftentimes those are false positive tests. And doesn't mean you're not having symptoms. Doesn't mean you don't have a cold or a respiratory syncytial virus or even the flu. But a repeat of the COVID in a regular person with a normally functioning immune system is a rare bird indeed. Okay, next question. Karma from Cleveland, Ohio. Dr. Kai, I'm currently on Mounjaro 2.5. Next week I move to the 5. Is there a difference in the amount? Will it make me feel differently? Hopefully, Carmen, because you're titrating up. Most people don't have to go higher than the 5 milligram dose on the Mounjaro. They get great benefit. It suppresses your appetite. It increases your metabolism. It makes you lose weight. You have been fortunate enough that hopefully somebody's covering the cost of that Mounjaro, because it can cost up to $1,600. That's $1,600 for 1 month's supply if insurance is not covering it. But if they are covering, or if you're getting it another source, great. It works wonderfully. There is a 1 milligram dose. There's a middle dose of 7.5 milligrams, and then a 1 milligram dose. But I have rarely had to go higher than 5 than 5 milligram dose. So you just have to see how much weight you need to lose and how you're tolerating it. If you start to plateau, or if you feel like you're not losing enough quickly enough, then you can go to a higher dose. But again, this is where you discuss this intimately with your provider, whoever's giving it to you, to see how you respond to it. The biggest issue that I'm having in my practice now is that people that have been on it, they've lost the weight. Now they want to know what to do about maintenance. Maintenance can range from stopping it completely and seeing what happens. And, my point being, don't wait until you start to gain weight. Or if you do start to gain weight, don't wait until you gain 5 pounds or more. And when you see that you're trending up, then consider going back on the medication. And to keep, the question is, at what dosing regimen? Do you still take it once a week at a lower dose? Do you take a higher dose once every 2 weeks? The recommendations vary, and the tolerance level vary as well. The prescription guidelines often say stay at the highest dose for maintenance. But what I'm seeing is patients, 1, don't want to do that, and 2, don't need to do that to get the benefit of the weight loss. So in real world treatments, you might be able to back off and stay at the 2.5 for maintenance, or you may take the 5 every other week or once a month or whatever it takes. We are literally learning how to do this in real time, and it varies from person to person as to how people will respond to the maintenance phase. So everybody's done amazingly well losing the weight with these products. Now the question will be, where are we going to be 6 months to a year from now? that is when you know you have a good weight loss product or something that has changed. That is why I like the Lipodrops line. I have people that are doing the injections with the Mounjaro and the Ozempic, and taking the Lipodrops and taking the Keto Max and taking the probiotics, because that total together gives you a greater ability to control your metabolism and to lose weight. So those are things that are compatible to take. You can do so with no question or concerns about incompatibility or drug interactions, etc. You'll just lose more weight quicker and hopefully maintain. You might be able to do that and then just use the lipo products for your maintenance so that you don't gain the weight back. Because losing the weight when you have been successful in doing so, there's nothing more disheartening than gaining it back and 6 months later, being 20 pounds over whatever your starting weight was, because once you started gaining, you just couldn't control it. And this is not human nature. This is not your inability to commit. This is not, poor willpower. There's a bad hormone in our body called ghrelin, Grelin, ghrelin. I call it ghrelin, the gremlin. It makes you eat. It tells your body to eat. It tells your body that you're hungry. And when you lose weight, the levels of ghrelin increase. And they keep telling you to eat, eat, eat. That's one of the benefits of the injectables like Mounjaro and Ozempic. They block that response, so you don't get that ghrelin increase. But when you lose weight, the ghrelin hormone level keeps going up, keeps going up. It keeps telling you you can't win this battle. It keeps telling you to eat and that you're hungry, and to eat and that you're hungry. Eventually, the levels get at a high enough point that you eat because you're hungry. And what happens is it doesn't cut off once you gain the weight. It keeps going. And that's why most people gain back more than they lost. You lose 30 pounds, you gain back that 30 plus 10 additional pounds before your thermostat is reset. But whatever your weight you have been at, particularly if you have been at a weight for a certain period of time, years, you've been at 30 pounds overweight for a few years now, that is now where your body's thermostat is set. And the ghrelin wants you to go back to that number, the gremlin hormone. So it's very difficult to reset that thermostat. And that's one of the benefits of those types of medications, to reset it. One of those benefits of the Lipodrop product line, particularly the maximum strength Lipodrops, is it allows you to alter your body's metabolism, reset that thermostat, and hopefully maintain a healthy lifestyle where you're requiring less to eat and you are actually eating less, and you're maintaining your weight loss and more closer to your ideal body weight. Okay, next question. When do you think a person should see a neurologist? When you have a neurological problem, Monica, that is a great question. People that have seizures, people that have symptoms consistent with things like multiple sclerosis, weakness on one side or the other. If you've had a stroke and you have what's called hemiplegia or paralysis on one side of your body, or paraplegia, paralysis on the lower part of your body. All these things are reasons to see a neurologist. If you have a twitch, if you have something that the nerves in your body are not working well, then that is definitely a reason to see a neurologist. But you can always start off with your primary care doctor and see if there's a reason to go to the neurologist. Oftentimes people walk into my office with a request, and oftentimes they demand for specialty services. They'll say, I need to see an orthopedist, or I need to see a dermatologist, or I need to see a neurologist. And I say, well, what is the problem? And then they tell me what the problem is. And I say, oh, I can take care of that. It's well within my armamentarium, well within my diagnostic capabilities. I have experience treating it. I have patients, lots of them that I'm treating with this disease process. I can handle it. If we start to treat it and I can't handle it, I will refer you without a problem. This is what happens most of the time for primary care doctors' visits. But if you and the doctor agree, hey, you do need to see a specialist, or if you just ask, say, look, I'd like to get a second opinion or first opinion from a specialist in this area, then nobody's going to hesitate and hold that back from you. The problem is, to see a neurologist, you very often will need a referral from your primary care doctor. You can't just call the neurologist's office and go. The only way that will happen is if they meet you in the emergency room. You go to the emergency room with a neurological issue. You have Bell's palsy, where one side of your face is paralyzed, or you've had a heart attack. You've had a stroke, rather, or some other neurological issue. They call in neurologists. They see you in the emergency room or in the hospital, and then they have you follow up in their office after that visit. Other than that, the vast majority of insurance companies require a primary care visit before a referral for specialty care. Okay, final question, Havoc. Let's do it. Alicia, Nurse Betty Kim. Nurse Betty, thank you so much. Is stomach reconstruction surgery good? If you're talking about things like gastric bypass, it depends. The skill of the surgeon and the quality of the bypass. Gastric bypass is a rearranging of the plumbing of your stomach. And people do great for as weight loss is concerned, but it's maintenance of lifestyle afterwards. Most people get what's called the dumping syndrome, which means that they eat too much too fast. They get uncontrollable, explosive diarrhea. So they're just getting into the golden corral and settling in, and they're eating well, and they can't finish their meal before they have to run to the bathroom, oftentimes having accidents on the way. Now, there's another procedure where they change the anatomy of the stomach. They take a stomach that's about the size of a 2-liter Coke bottle, and they fold it on itself and make it about the size of a banana. That's called a gastric sleeve. That is an amazing process, and it can be easily reversed if for whatever reason you had some problems with it. But creating the gastric sleeve creates a decreased area in your stomach for food absorption. So you eat less. One, your stomach capacity for food before you get really full is less, and you're absorbing less calories. So that is a great compromise as far as reconstruction is concerned, and one that I recommend. I recommend the gastric sleeve over the gastric bypass. Gastric bypass does have indications that some people will need or require. It's the most common procedure that you see on television shows like My 600-Pound Life. Everybody's getting gastric bypasses there. I'm sure Dr. Nazi does gastric sleeve as well, because most doctors have morphed to that process. But again, if you're getting stomach reconstruction for weight loss, the sleeve is what I recommend. But discuss it with the doctor, the bariatrician, the doctor that specializes in that, to see which process is the best one for you. Okay, this brings to an end this episode of the Your Health is Important Facebook Live broadcast. We thank you so much, the listeners, for tuning in, asking your questions. Phenomenal questions tonight. We really appreciate you tuning in. I hope that everybody listening, watching, benefited from those questions that were being asked. Remember, when you ask a question, there's probably 1 million other people that are watching that had that same question but couldn't get in, or just weren't able to watch, or just didn't take the time to get their question up front. Our call screener Havoc does a great job and great question, keeping the questions rolling. We want to thank him for a great production this evening. And remember, look, everybody have a wonderful Thanksgiving. We will see you next the week after. And then we'll have a one broadcast in December. Then starting in January, when everybody's trying to get their sexy back, their New Year's resolution to lose weight, we'll be coming at you every week. Okay, so great problem, great process. Thank you again. We appreciate you, and we'll see you next time.